You'll take a perk 30, but you will not get a vaccine for COVID.
I mean, you can smoke weed that's laced. You could take a pill and have an allergic reaction. A lot
from
of
a
things
stranger. You're copying from a stranger, and you.
Yo, you don't even know if your plug has been tested for COVID.
You don't,
and you going to pick up.
The same plug. You don't know. You don't. I've been seeing people, but I'm just like, now what if he had COVID? What if she had COVID? What's wrong with you?
Manny's memos. Manny's memos.
Manny's Monday memos. Manny's Monday memos. Manny's Monday memos. Manny's Monday memos. Manny's Monday memo. Ho. Manny's Monday memo. Hoes. 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 Hoes.
Happy Monday, guys. I have Sim and Justin with me. And today I thought, let's talk about the COVID-19 vaccine. Sim and Justin both got the vaccine. And there's just so much crazy stuff on the internet. So, I'd like to know if Sim and Justin feel like, their penis is going to fall off, or if they feel like they're going to die, or if they feel like it's going to make them infertile. Those are some of the things we're seeing on the internet. So how about we just talk about it? Because both of y'all got the vaccine. So, I feel like you have a right to say whether or not you believe these conspiracies. So why don't we just go ahead and jump right into it? Like just talk about it.
I think for me, working in the field that I work in, epidemiologist, public health, even just going through grad school, obviously, naturally, with vaccines and vaccine trials, you're going to have your cases because I feel like that's where a lot of the sources of these conspiracy theories are coming from. People are reading reports from the vaccine trials and how people have allergic reactions to these medicines and things like just that. And even when I talk to my group of friends about it, and they're like asking about, well, we saw that in Kentucky, 2 nurses took it and they stop breathing or something like that, whatever happens to them. And I would just always tell them that, and this is why I don't believe it. When you have this mass vaccination program that we're having, and you're having hundreds and hundreds of thousands of people getting vaccinated at a time, every day people have a negative reaction or an allergic reaction to a vaccine. So when you scale that up from this is just one vaccine doing it to 3 people in California every year to hundreds of thousands of people, you're going to see a higher number of people having these allergic reactions. But once you quantify that and kind of scale that up to the scale that we're vaccinating everyone, that rate doesn't exceed what would happen normally in any year. So to the whole, people are like getting allergic reactions from it. They're passing out from it. They're getting migraines from it. They're getting, I think it was Bell palsy was one of the things where people's faces was like stuck and stuff like that. When you just multiply that and scale it to the normal background rate to what you see every day, you see if this was just scaled down to only 10 people and one of them would have got it, that's normal. And I don't worry about stuff like that because that's how I think about it. And hopefully that people can understand that. But I understand it's a foreign concept to most people because this is our first time really paying attention to a vaccine for real.
What about you, Sam? What do you think?
It was interesting to me because we actually, basically my whole P1 year, it was basically the importance of immunization and vaccination, which is something that I had already kind of gotten into the routine of. I can't speak because I don't remember prior to, me taking control of my own, health, how many times or if I did get, a vaccination yearly to keep up. But starting working in the pharmacy field as a pharmacy tech, it was just, that was a normal thing. I want to make sure that I protect myself. And by protecting myself, I'm then protecting others, because if I get the flu and I am working in the pharmacy and I'm handling people's medication or I'm talking with them or helping them out in the store, if I'm sick, that just poses a greater risk for the community that I'm there supposed to be helping and serving. And so even as a pharmacy student, it was just there's this concept of what we call herd immunity. And the goal of vaccination or immunizing oneself is to ensure that what basically reflect the concept I just said, that you are not only protecting yourself, but you're protecting others. So Juice was dead on with it. Just because you are getting reports of like there's this one person or there's these 3 people here or 5 people here who've had a reaction to it. It's just like, one, we know that medicine is not perfect.
Mm-hmm.
We know that science is not perfect. And we know that every one of us are indeed uniquely made. So everything that is created is not going to be a blanket. But the most important thing to remember is the more people we can vaccinate, the more people we can get immune to the disease or the infection, that's better for everyone. Because I would say, on the flip side, if you have 10,000 people who did not get the vaccine, and you have 3 people who did, those 3 people will be fine. But how are we going to have that health care, the resources and the supplies to help bring those 10,000 back to health, opposed to opposite? Like, if we had 10,000 that are vaccinated and healthy, opposed to those 2 or 3 people, we can still save their lives. But I will say, me being me, I'm not really big into news or things like that. Like we've talked about this from previous Manny Monday memos. Like, I get my news from Twitter or like social media. So of course you see all of this, and I won't lie. Like, how can you not, like, damn, like I'm seeing this, and this. It's like so many reports of X, Y, and Z is going on from people having taken the vaccine, or even it being pushed. Like, propaganda does play a big role in that. So I won't lie and say I didn't have any concerns, but at the end of the day, it was like, yo, I cannot be passionate about the field of pharmacy and not lead by example. So
No,
that
I
was the
think
whole
that's a
reason
good
why I
point.
got the vaccine.
Okay, so you got it for your field, and then Justin, what made you essentially get the vaccine? Because, you know, like Sim said, there's a lot of propaganda, so why get it?
For those same reasons, I feel like I can't be an officer or in the field of public health, and having the information that I have and understanding the way that vaccine works, the way that infections work, the way that negative reactions to vaccines work. I feel like I just can't understand all of those things and go out and not get a vaccination. Like Sim said, I 100% get the fears, the concerns. We've all seen and know about and aware of the things that our people have gone through in the past in terms of vaccinations and studies and medicines in general from the government and things such as that. I understand all of that, but knowing the way that the process that this vaccination is made, the way that it works, I trusted all of that. I'm a professional. I've seen people, my coworkers, they've had it since December. They're 100% fine. So taking all that in consideration, and plus I just wanted to keep me, my friends, and my circle healthy, my herd healthy, I decided to go get it. So I feel fine. So,
I would say because you both have taken it. I would say, when do you guys get your second dose? Because you both got your first dose. So when do you take your second dose?
So you're probably closer. You got yours before mine.
Yeah, mine is supposed to be February 7th. But the thing is, like, I was able to get it because I'm an essential worker, but I don't work during the semester. So Navicent was able to give me my first dose, and I just have my placard so that I can get it from like the health department up here for my second dose.
Yeah, I get mine first week in February. I want to say like the 5th. So that's a Friday, I think. So yeah, I get mine. It's the same reason I'm an essential worker. So they sent out an email saying, hey, you guys are all class 1A or something, essential workers. If you want, my job doesn't force me. But if you want, sign up. They have slots right here. Sign in, go do it. I signed up for it. I went and did it. It was like 10 minutes. They observed me for like 25 minutes. I was fine. And outside of like having like your arm is sore from when you get any type of shot. Other than that, I didn't have any symptoms. I didn't feel like tired or sick or like I had COVID. I felt 100% fine. And then,
what about you?
That's awesome. It was I was just want, like just there. It was amazing because when I wanted to highlight that it was completely voluntary. And the thing about it is, me having to learn the process of what it looks like to properly vaccinate someone was just really exaggerated or highlighted or emphasized during this time of COVID, because what people don't normally know is even when you get a regular vaccine, whether that's a flu shot, a shingle shot, like any type of immunization or vaccination, you are supposed to be observed for 15 minutes after, just to ensure that there are no serious adverse reactions, because if you are indeed allergic to or something in the vaccine, then it will immediately happen, which is why you are not supposed to vaccinate someone without the presence of someone who's basically knows the protocol of immunizing a person, i.e. a pharmacist, and you have to have an EpiPen on hand just because you never know. So that's something that I felt like people are going to think is new, but in actuality, any person in the farm, if you walk into a CVS, like that's supposed to be happening. So normally what I'll see with handling older patients or customers, they'll come in and get their flu vaccine, and the pharmacist will just ask them like, hey, if you don't mind just walking around the store or staying around, if you have any further questions, just try not to leave. But at that point, once that information is given to the customer, it's their decision whether they want to go out to the car or if they want to leave X, Y, and Z. But the proper protocol is to observe. And the other thing too, the arm soreness. Now I'm going to say this was extremely different for me because I'm normally aware of the arm soreness that comes with it. So what I even tell people after immunizing them, I'll be like, okay, if they're younger, I'll be like, if you're going to work out or if you're going to do something today, I would highly advise that you do that because you want to keep the blood pumping to that muscle, the blood vessels, because you just punctured you in the arm. But the thing is, my soreness, it lasted extremely longer. So mine, I felt it for at least like 3 or 4 days after the shot. And normally I don't do that. Like I even worked out right after, but my arm was sore. But other than that, I did not experience anything out of the norm of me taking my other vaccinations. And it was funny because my mom, she was really surprised that I did it. But I got onto her at the beginning of the pandemic. Like she was really on me. She was like, oh, you just ripping and running, you doing this, that, and the third. Like it's not a whole pandemic. I was like, Mom, you worry about COVID, but you do not get your flu vaccine. Tell me how many people died in this past flu season. And the reason why it's so, I feel like it's so publicized and dramatic per se. I'm using the adjective dramatic because like, I feel like it is blown out of proportion with little base knowledge that people have. So we are sitting in a middle of a pandemic. So of course, what you're going to always hear is COVID, 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 COVID. Mm-hmm. But it's just like, even myself, when it first started, I did not listen. Like I said, I don't look at news outlets, things like that. I would just check the CDC's website just to see like, okay, how many people have been infected today? Like what is it? And even all the way up until like June, I was like, yo, like, yes, a lot of people have died, but I'm looking at it like how'd you say it, looking at it on a larger scale is like, okay, I'm not being insensitive to the lives that we lost because it could have been handled better in terms of preparing for it. But it's just like, yo, anybody in the healthcare field or like in public health or things like basically this realm of knowledge knows like, okay, this is wild, but it's not just outrageous, if that makes sense.
No, I think it does make sense. That makes sense.
I think what causes the mass attention to it is that how a lot of these deaths are unnecessary. I feel like we had a different leadership, different administration to hammer down these rules and regulations to keep people as safe as possible. I think that is what causes people to cover it the way that we do. Even as we see now the vaccination rollout, Sim can tell you, like, I want to say like when the vaccine first started getting rolled out in the beginning of December, they had a goal of trying to vaccinate at least 20 million people. I think by New Year's Eve, we had like 4 million people vaccinated. That's because the current administration, they were only really concerned about getting the vaccine developed and shipping it to the States. And it was just do what you want to do once you get it. And then so you got people that didn't have nearly enough people in place to vaccinate people. You don't have sites for people to go. You have websites crashing for people over the age of 65 trying to sign up for it. I feel like once the vaccine was developed, it was just fumbled. But even before that, I just felt like we were just not on the same page as a nation from the jump. And I feel like that is what brought that attention to what we're in the middle of. It was more so like, again, like Sim said, being respectful and sensitive and empathizing with people that may have lost someone during the pandemic or someone that got severely sick. But it was more so like if we could have all been on the same page and we need to do this, this, and this, hold this down, and develop a vaccine. If we sit this out until December, by first quarter of 2021, we'll be fine. And we didn't do that, and I feel like that's what caused the attention to it. And now you're getting every 4 days 1 million new cases, which is insane. 1 million new cases of a disease every 4 days.
No, it's extremely insane. That's why we're looking at countries like New Zealand that's COVID-free, or we're looking at other European nations that, we're looking at Norway, we're looking at other places that have less than 10 cases a day. China, who we all know this is where it originated, they're living life normally, right? But we're the ones that are now in this new norm, and people are comfortable with this new norm. And to me, I'm just like, you people are crazy. I'm not comfortable with this. Like, this is not okay for me. Like, this is not okay. But like you said, I agree with you. I think this administration was only worried about saying that they got the vaccine out just so that they can take credit. But they don't really truly give a damn if people get the vaccine. I think exactly what you said is true. They just wanted the credit to say, when I was president, when we were in Congress, this is what happened. Okay, yeah, that's cute. But what did you do to help everybody? Because they always love to talk about Obama and the H1N1. Yeah, nobody died at this alarming rate, nor did it affect us to this magnitude. Like, let's be real, a lot of people didn't even really know about H1N1. They're like, wait, what's that? Exactly, because the government went ahead and took that thing, controlled it, and we were living life normally. Or how about, it's just like, what's wrong with you people? Zika, all this stuff, you're wondering why it never touches close to home because it's handled and taken care of. But when you're now with COVID, you have all these people. It's now a new norm that, like, if I walk outside without a mask on, guys, I'm just like, something's wrong on my face. Like, I feel naked. It's just like, dang, I forgot my mask. Like, this is our new life. Like, this is, I got to wear a mask everywhere I go. And people hate wearing their masks.
And it didn't have to be.
No.
It didn't have to be like this. But what really got me, because I just like to sit back and draw parallels between it, is just like, okay, so especially like when the mandate first began to roll out, it's just like people like, I'm not wearing a mask. And so I just find it just really funny is to have a person who refuses to wear a mask but also refuses to get the vaccine. But what's even more comical to me is having a person who actively participates in safe COVID protocol and still not wanting to get the vaccine. Because it's just like, what the fuck is wrong with you? Like, what you are an inconsistent individual. Like, if you are saying you will follow the rules to prevent COVID, but you won't take the necessary steps to protect self, is mind-boggling to me. So it was just, that's why I used that example earlier. Like, Mom, you're over here hounding me about me going to a restaurant on a rooftop outside during the pandemic where everything is sanitized, but you refuse to get a flu vaccine. Like, your immunization charts are not up to date, and you are sitting here hassling me about COVID-19.
I'm gonna tell you who's gonna start getting people later on this year, when it's like, when you want to go to, I don't know if the club would do it, but you want to go to this concert or this sporting event, we need to see that card.
No, when you want to go to college,
exactly.
The European countries are talking about making it a rule that coming into their borders, you have to have the vaccine. And I'm like,
when you go to Mercer, when you go to most colleges here, you have to have some.
You gotta get it. Meningitis. You have to get meningitis.
If you went to any college, you had to get an immunization. You have to show your immunization forwards and records, so you won't go take a goddamn shower in a public shower and give everybody meningitis or something like that.
Exactly.
We just stubborn, and we don't like to be told what to be done. We're not used to change. So like, yes, growing up, we know you got to have our immunizations in order to go to pre-K, kindergarten, like just be around other kids. Before you even enter the schooling system, you must be immunized. But us as people, like we legit are living through history. So it's mind-boggling for us to take that perspective of like, yeah, life isn't going to be the same for the rest of our lives. Like shit happens. And the thing about it is how you adjust to life and like what the results will be. So like the transition could be really easy or it could be really hard. And for me, I'm hurt by like the ignorance that has been spread during this time about vaccines. Because I even had coworkers that work at, I'm not gonna restate the name of the hospital, but I have hospital coworkers who are looking at me and like, oh, you going to get that vaccine? Like, I don't trust it. And it's just like that right there. Like you work in the environment. You have to go to COVID areas. Why would you not protect yourself only because of something that not a doctor said, not a pharmacist, not a nurse practitioner, not a nurse, but because of the journalists on prime time, or because that's what they said, or they brought in an expert, which was really just a scientist that they found who would say to say, well, this one little tiny aspect of it could potentially kill you.
Man,
but they're looking at the 0.01%. They're yes. Like you telling me you take a perk 50 or you'll take a perk 30, but you will not get a vaccine for COVID.
I mean, you could smoke weed that's laced. You could take a pill and have an allergic reaction. A lot of things
stranger. You're copying from a stranger, and you.
Yo, you don't even know if your plug has been tested for COVID.
You don't.
And you going to pick up.
The same plug. You don't know. You don't. I've been seeing people, but I'm just like, now what if he had COVID? What if she had COVID? What's wrong with you? I mean, but y'all, just like Justin said earlier, it circles back to like our community just not trusting it based off of the trials that happened in which we know of.
No, that's so bad.
Manny's Monday Memos, Manny's Monday Memos, Manny's Monday Memos, Manny's Monday Memos.